Few parents give importance to snoring in babies. They think that it is something normal and therefore they do not get to discuss it with the pediatrician of the small ones when it corresponds to them some medical revision. According to the Spanish Association of Pediatrics, habitual snoring should not be seen as normal. They are not healthy for babies. The most common cause of snoring is not worrisome, if not accompanied by other symptoms, since it is the cold. A cold can partially block the airways. Then, after a few days the child will stop snoring, and what we have to try is to keep the roots as clear as possible, doing nasal washes, especially before sleeping. Sleep apnea-hypopnea syndrome. In these cases, snoring is accompanied by symptoms such as stopping breathing for a few seconds, or that the baby seems to struggle at night, that he sweats a lot or adopts strange postures when sleeping. Somewhat older children who suffer from this syndrome also show poor school performance, attention deficit, nocturnal enuresis, lack of appetite. It is important that, if we suspect that snoring is a symptom of this syndrome, we should discuss this with the pediatrician so that they carry out the pertinent tests. It could be that the passage of air through the upper airway is hampered by overgrown vegetations or tonsils. There is also the possibility that there is some abnormality in the shape of the oral cavity and the jaw. Other causes of the baby snoring can be an infectious or allergic rhinitis, asthma, if there is regurgitation of food or if he is exposed to tobacco smoke. Several of these factors may occur together for the child to emit snoring. We have seen that babies snore due to various causes, but if it does occasionally and coinciding with colds, we should not worry. If your child snores regularly without being cold, tell your pediatrician. Maybe it's harder for you to stop making that rough sound when you sleep and have quality sleep, but there are ways to do it. According to the latest research, it is estimated that 1 in 10 children snores regularly, especially after 22 months. And although its frequency has been decreasing since the age of 9, pediatricians warn that childhood snoring is not regularly healthy. It can hide serious illnesses like lack of sleep.